Hi students. So basically these session or these classes will be discussing about the clinical nutrition and medical nutrition management for CHD and heart failure. We'll be discussing about the coronary heart disease and heart failure. What would be the nutritional intervention or dietary management for the patients who have CHD or heart failure problem. Not only that, we'll be discussing about hypertension, myocardial infarction, dyslipidemia, ischemia, and also angina. So let's start, let's the ball rolling. So eating for a heart healthy lifestyle, we have to understand the basic nutrition. We always try to refer the American Heart Associations where they say try to maintain a healthy weight, healthy body weight, because we know not only diabetes but also obesity is a risk factor for the cardio patients. Maintain healthy cholesterol level, maintain normal blood pressure, what we can say normal tension or normotensive, maintain normal blood sugar levels, that means normoglycemic, physical inactivity, use and exposure to tobacco products. So we shouldn't do physical inactivity, we should be physical active. And also, so this is a heart healthy food pyramid where we can see the beneath portion is a very larger size where we can see people can run, having lot of vegetables like orange color, yellow color, white color, green color, where you can see vegetables like Indian flag color. Be physically active, enjoy meals with others, and also exercises. And so the next time above, there's the greens, all the greens like green leafy vegetables, other vegetables with a very good content of chlorophyll. So it's a very good antioxidant, very good amount of phytochemicals. So these are there. Above that, we can see there are a lot of fruits, different color fruits, seasonal fruits, whole grains. So what are the recommendation? Fruits and veggies, whole grain, high fiber, oily fish, lean meats, fat-free, skim, low-fat, 1% dairy, reduce added sugars because sugar is an empty calorie. You know very well that if we take 100 gram of sugar, we can get only 100 grams of carbohydrate, which is very empty calorie kind of thing. So there is no sugar at all and little or no salt. Salt part will be covering later on, what is the amount of salt and what is the exact amount of salt we can take for a cardiovascular patient. Now we are talking about the fat. So if we talk about the fat, so definitely we are talking about the visible fat basically. So if in case of the visible fat part, that is incorporated is diet should be rich in unsaturated fatty acid and should not provide more than 20% of the total energy. So basically, if we talk about the fat, so we are talking about the good fat. Okay. So dietary fat is a consistent support for the hypothesis of the both the quantity and quality of the fat directly associated with the elevation of most blood lipids, particularly LDL, low density lipoprotein cholesterol. It has learned Now we are coming the sodium restriction. Sodium restriction in CHD, specifically if we highlighted the sodium restriction for the hypertension patients, hypertensive patient, high blood pressure hypertension patients. So now you have to understand that 1 teaspoon of salt, 1 teaspoon means 5 gram. 1 teaspoon salt, basically 2000 mg of sodium. 2000 mg or 2 gram of sodium. 2 gram of sodium. So if the 5 gram salt is there, then out of 5 gram, 2 gram of sodium, because we know sodium chloride is the chemical name of salt, table salt. So 2 gram of sodium or 2000 mg of sodium is present. Now we will talk about the sodium restriction. How do you do that? Studies have shown that sodium restriction along strict sodium restriction 0.5 gram sodium 500 mg. Apart from the restriction stated above, meat, milk and eggs are allowed in small portion and vegetables with higher sodium content are avoided. In severe sodium restriction, that is 0.25 gram sodium 250 mg, this level is too restrictive and nutritionally inadequate and realistic to be used practically. In this, restricted quantities of meat and eggs are used in occasionally. I have talked about the heart failure patient. In the heart failure patient, basically the 1.5 gram 1.5 gram sodium is recommended for the heart failure patient basically. So what is low sodium diet? Basically the foods are bread, chapatis, wheat, rice, maize, jowar. So this is a food packaging levels, that is some things outside from your book also. This slide is very critical, that you how to understand the food packaging level, because this is a packaging level where all the nutritional fact is written. So once someone is shopping from the outside market, they has to be checked about this reading food levels, where the sodium is mentioned, potassium is mentioned, cholesterol is mentioned, everything is. So packaging of food is very important. How do the food package, so accordingly people can purchase foods from the outside market. So this is something is very practical scenario that students can understand. Now here is a slide, the salty foods less often, and the three colors are there. Green means smiley, moderate means less smiley, food high in salt is strictly known as an angry kind of sign, because people can't allow of these things of food. So if it's smiley type food prepared at home basically, and fresh ingredient, fruits and vegetables, unsalted nuts and seeds, beans, lentils, peas, pasta, plain popcorn. Like pasta, it is very Italian, but rice is okay. Is perfectly all right with us. Oats, fresh fish, fresh chicken meat, eggs, yogurt, because we know the very good amount of probiotics is yogurt and curd, like lactobacillus, bifidobacterium present. Okay, and also lemon juice. In case of moderate type, there are salted nuts, pastries, cakes. Okay, soft tough margarine. This is a very moderate kind of thing, but those is not allowed. Okay, and hard dash diet. This is very important, students, because this is also for your learning, your MSc theories, practicals, and your day-to-day life while counseling the patient. That is very important. So what is dash diet all about? The full form of DASH diet is dietary approaches to stop hypertension, has been shown to help lower blood pressure and prevent heart disease, stroke, diabetes, and even some forms of cancer. It focuses on eating more fresh fruits and vegetables. This is a guide to how much of each food group you should eat every day based on eating some certain amount of calories per day. So, in case of weight reduction, your MSc book is written as MFN 005. Maintain normal body weight, BMI 18.5 to 24.9. So now we're talking about the hyperkalemia. Okay, sometimes there are certain medications, they have lot of, you know, drug nutrient interaction. If we talk about ARNI, okay, angiotensin receptor of neprilysin inhibitors, there are the adverse events is hyperkalemia. If we talk about mineralocorticoids antagonist receptor, MRAs, receptor antagonist, MRAs, like spirulactone, aldactone, this kind of thing. So in that cases, we should always suggest a low potassium diet. Okay, so here is the chart you can find which are the potassium, low potassium. In low potassium, basically 0 to 100 mg, medium potassium 101 to 2000 mg, and also high potassium, that is 2000 mg. And here is also example low potassium foods, high potassium foods for your references. You can see as a pictorial presentation. Now we are discussing about the fluid. So fluid restriction is necessary. Fluid restriction, students try to understand, is necessary only if edema is present. Only if edema is present. I already talked and spoke about edema in the previous lecture slides, that what is edema all about. So if edema is present, but in that case is also theory you should understand, but practically you always try to follow a cardiologist or a physician's prescription, what kind of drugs he or she has written. If diuretics is there during the summer, where uh, we loses our isotonic salt, their invisible perspiration, this happens. So in that cases the so this is the basically a measurements of fluid what I try to showcase in this presentation. A very peanut kind of thing. So you can, at the nutshell, you can just see and also document. Yes, some people have the question that if what they can do if they go thirsty. So being thirsty is very common. This does not mean that body needs more fluid. So you have to be more careful. Use ice chips. Just rinse your mouth. Freeze juice and ice cube tray. Lemon wedge. Chewing gum. Definitely sugar-free chewing gum. Strawberries. So this is the way they can can some kind of lubricate of their mouth for the psychological problem. So this is something they need to. So in cases that the practical present patient, if you see the in ward in cardio patients in during internship, this will be a very helpful. Caffeine, high salt drinks should be avoided. Now, there are certain drug, there are certain drug, there are certain drugs, like any anticoagulant drug, like warfarin, comadine, hmm, acetrom, this kind of drug. There always, being a dietitian, you try to restrict vitamin K rich food, not only fruits, vitamin K rich foods. So, in that cases, I have been listed high, moderate, and low. In case of high, broccoli, Brussels sprout, cabbage, canola oil, lettuce, parsley, soybean oil, spinach. This is the way high. Moderate is asparagus, cheese, margarine, olive oil, peas, red cabbage, and low is alfalfa, beans,